Today is really about opiates, prescription drugs. Give more power to the medical board. They will be held accountable.
We're going to drive these doctors out of the state of Ohio. We're going to take their licenses from them, and we're going to put them in prison.
There's almost a presumption that if people come in, it's like a drug seeker almost anymore.
Anytime you make such a drastic change, unintended consequences will occur.
Some of the stories we're getting are the patients are even feeling blackmailed.
I was arrested when a SWAT team of about 20 law enforcement officials descended on my clinic at 9 in the morning.
We had a very specific problem in a very specific part of the state. And to use a military analogy, instead of taking a rifle and eliminating the problem, they carpet bombed the state.
Basically, pain has changed substantially recently with the introduction of House Bill 93, which was a bill that the governor and a physician in the region of Chillicothe, Ohio, proposed for the control and management of pain clinics and pain doctors. What seems on the surface to be a well-meaning bill has unfortunately created a significant number of problems now for pain patients and for pain doctors. Then the controls that are in that bill are now being developed to the point where there's so many milligrams that you can get. And there's all sorts of triggers that make it such that the general practitioner and the family doctors do not want to be involved with this because the state medical board, the pharmacy board, and the nursing board are now becoming very rigid in their controls. The pharmacy board has a mechanism called ORS, which is a computerized database that every narcotic is put into a database. And they're beginning to use these to scrutinize what's going on. So on the surface, this appears to be a very good sort of system to control the problem. Problem is that the system is starting to come down hard, which is making physicians not want to prescribe and subjecting physicians to investigations, making patients go through contracts and a lot of testing that's probably not all that necessary. Now, there's no question that there's been an increase in prescriptions written for pain patients and for patients in general. The issue remains that it's substantiated by the fact that 80% of the visits to a physician in this country and throughout the world relate to pain. Well over 100 million Americans suffer from chronic pain, and more are not being treated. So we have a major problem. And the pushback onto the pain is really not justified as when you look at these statistics. Pain in general has not decreased. Access to pain is still a major problem. So now as we're controlling it, there's absolute proof that blacks, inner city people, do not have proper access. People without insurance have no access to the pain management. So we have a problem in which human suffering is now being monitored and being treated by the laws rather than by medicine.
Michael Jackson's death unleashed a flurry of media stories about all aspects of the pop star's life, including his alleged prescription drug abuse.
His prescription drug use and alleged abuse.
Pop star's possible drug use.
The pop star was taking a combination of Demerol, Vicodin, Dilaudid, Xanax.
On the same day, countless millions watched Jackson's star-studded memorial service. Reason TV interviewed another musician. This song is by Sean Clark Redman, a man who enjoyed an active life before the neurodegenerative disease ALS, often referred to as Lou Gehrig's disease, rendered him nearly immobile. He can no longer even play the piano. The disease also left him in nearly constant pain.
At times, the pain can go so deep, it feels like, it's right down to the bone.
Unlike Michael Jackson, Redman admits to having a problem with pain medication. However, his problem is very different than the one the King of Pop is rumored to have had.
Since Michael Jackson's death, we're learning more about rampant abuse.
Redman's isn't the overdosing problem we hear so much about.
This is underdosing.
Redman's caretaker and partner, Steve Altman, says Redman is prescribed some medication, but not nearly enough to keep his pain under control.
It's just so frustrating and stressful to watch him in pain and know that there are forces behind us that don't want him to get the medication he needs. When he doesn't have the medication, it's hell.
I want to die, I just want to die.
Chronic pain in America is an enormously undertreated disease. It's a public health disaster.
Dr. Frank Fisher is a Harvard-trained physician. He says Redman's plight is an appallingly common one. Instead of receiving the medication they need, millions of Americans suffer needlessly, according to Fisher and other pain specialists. Consider nursing home residents. According to findings published in the Journal of the American Medical Association, 41% of them endure severe chronic pain. How could that be? Because law enforcement interferes with the doctor-patient relationship, making doctors fearful of prescribing high doses of opioids.
When a patient develops severe chronic pain, basically there's only one class of medications that's going to work. That's opioid analgesics.
OxyContin.
Demerol, Vicodin.
In other words, the same pain medication so often associated with celebrity overdose and addiction.
Well, these celebrity cases are propaganda. They don't reflect the problem with these drugs in America.
Fisher practices medicine far outside the Hollywood paparazzi zone in the northern California town of Rio Del. He has no celebrity clients. As he's done throughout his career, he treats mainly poor people.
Poor people are already suspected of being drug addicts and criminals, and so are the doctors that treat them with controlled substances.
Fisher should know.
I was arrested when a SWAT team of about 20 law enforcement officials descended on my clinic at 9 in the morning.
Dr. Fisher was thrown in jail and charged with drug trafficking. And because some of his patients died with pain medication in their systems, he was also charged with 5 counts of murder.
They were trying to give me 256 to life, and that's pretty hair-raising to be sitting there looking at that sort of thing.
The murder charges were thrown out after investigators determined that his patients' deaths had nothing to do with the medication Fisher prescribed. Eventually, all charges against Fisher were dropped, but not before the doctor spent 5 months behind bars and years fighting to get his medical license back. 10 years on, he's still struggling.
It cost everything I had to defend myself and whatever I could borrow. And at this point, I'm 56 years old, and I'm starting over, and I have a net worth of 0.
What causes doctors to worry about cops in jails when they should be focused on treating patients?
What we're dealing with is a mass insanity. We call it the war on drugs.
The United States isn't supposed to be at war with itself.
Altman blames the drug war for the ongoing fight he wages with doctors to get Redman the medicine he needs.
They're afraid if they write that prescription, oh my God, they're going to get locked in jail. They're going to get put away.
It's true that most doctors don't get prosecuted, but it only takes a couple here and there, and that keeps the rest of the physicians in line.
The harder they clamp down, the harder it is for me to live with this disease.
Recently, President Obama's drug czar announced that he wants law enforcement to strengthen its monitoring of those who use prescription drugs. For Reason TV, I'm Nick Gillespie.
Working where I work in the emergency room, I've seen a change over the past few years where almost anymore, there's almost a presumption that if people come in for pain issues, that, it's a pain, seeking behavior of someone who is like a drug seeker almost anymore. And it's almost the fallback on expectation of most of the physicians that I work with. And God forbid if someone comes in more than one time to be seen. And there are different situations that these people are involved in. Someone's physician can retire or suddenly decide to move away or have to close their practice. Then all of the patients that they take care of are, seek their treatment, sometimes in the emergency room, and they're seen as drug seekers when they were even on the medication for, they could be on the very same medication for 10 years, and then they come to the emergency room once or twice because they can no longer get their medication. And there's a lot of dismay and, I think, a sense of hopelessness. There's been a number of patients that I've taken care of that someone will, I don't know how often they have an appointment, but let's just say someone goes and they are 1 or 2 pills off on a count. And this could be maybe the end of the month or something. We're talking about less than half a pill a week they're off, and they're dropped. They're suddenly just completely dropped from something. We've seen an increase in people who have been suddenly dropped from being able to have their medicine, switching to heroin as a cheap way to control their pain. So now we have a whole another subcategory of people who are coming in who are overdosing. The number of people that I've seen for narcotic overdose, I would say, has easily at least quadrupled. In the small emergency room I work in the last 2, 3, 4 years.
What we have now is pain patients who are concerned because many doctors, not only pain doctors, are concerned because of the regulations that have come down from HB 93. So what was a bill that was set up to protect has really become an enforcement that is actually no longer really promoting pain treatment. It's in fact now causing significant difficulty.
Randy asks that we not reveal his identity. He has been taking prescription drugs for more than a decade to control pain caused by degenerative disc disease in his spine.
And it's the kind of pain where you lay there and you literally want to cry because it hurts so bad.
Doctors have told him there's no cure for his condition. It's just a matter of how best to treat the pain. He's able to function, he says, because of a regimen that includes taking Vicodin and Dilaudid. But after several years of seeing increases in prescription drug overdoses and the growth of pill mills in southern Ohio, where certain doctors were obliging the pill seekers and cashing in on the drug trade, the state cracked down.
We're going to drive these doctors out of the state of Ohio. We're going to take their licenses from them, and we're going to put them in prison.
Last year, the governor signed a new law that puts limits on how many pills doctors can dispense directly to patients. And the law says if more than half of a doctor's patients are treated with controlled substances for pain, then the doctor's practice qualifies as a pain clinic and needs to be licensed by the state. There are substantial penalties for violators. The crackdown has worked on the pill mills. But there is growing evidence that the new law has had a chilling effect on primary care physicians, fearful of potentially violating the new rules.
The way in which a pain clinic is defined makes it so that many primary care doctors are very close to running a pain clinic.
Robert Twillman, Director of Policy for the American Academy of Pain Management, says doctors don't want to risk running up against state regulators.
So to protect themselves, what they do is try to get farther away from that cut point by stopping their prescribing for some patients.
And that's what Randy and other legitimate chronic pain patients are running into. Doctors refusing to write prescriptions, instead sending them to pain management clinics, where specialists often won't write the prescriptions without first trying a series of procedures. Union County doctor Amy Mestemaker is on the board of the Ohio Pain Initiative.
Some of the stories we're getting are the patients are even feeling blackmailed into, in order to get their prescription meds or even get their foot in the door someplace, that they have to agree to have injections, nerve blocks, things like that, that maybe haven't worked before.
Randy believes lawmakers overreacted.
We had a very specific problem in a very specific part of the state, and to use a military analogy, instead of taking a rifle and eliminating the problem, they carpet bombed the state.
State Representative and Dr. Terry Johnson from Scioto County co-authored the bill after seeing firsthand the devastation of prescription drug abuse.
Did you see that one coming? Absolutely. Anytime you make such a drastic change, unintended consequences will occur.
But Johnson says in time, doctors will see they don't need to stop prescribing. They just need to be more careful.
We're not really telling people how they do and don't prescribe these drugs. We're telling them to re-examine what they're doing with them and to think it through.
But patients like Randy can't wait for doctors to get comfortable with the new law. He's terrified by the possibility of being without the only drugs that he knows will provide relief.
My biggest fear is that I'm going to go through all of these processes and I get to the end of that road and the physician is still going to refuse to just prescribe the drugs that have worked for me.
And at that point, he says, he'll do what more and more chronic pain patients have already started to do, go to the emergency room. Another unintended consequence of the new law.
What has HB 93 done now? Positive. As far as I'm concerned, it's done this. It's indicated, which I believe the governor was right to indicate that there's a problem out there that we need to get a handle on. From that standpoint, it was good. How it's been carried out and how it's been beneficial, I think the jury is out from this standpoint, that I don't see that it's affected significantly the amount of pain patients that I see, because people still have pain. 80% of all visits are pain. How's that changed it? I'll tell you what it's done. My practice has become a nightmare. I have surgeons who do operations and say that patients that might have a pain contract, they don't want to prescribe the pain medicine. They want them to come to me to manage the pain. A lot of family doctors that don't want to deal with the medical board or don't want to deal with the DEA and the investigations that are going on. And I have pharmacists that don't want to hand out medications because they say the DEA is coming out there, the pharmacy board's coming out there. So I think it's had a negative effect. And the negative effect is that it's harming the pain patients. And the worst of all, that I don't see, we've seen the real outcome, is that when you limit, which I'm getting from insurance companies now, saying, no, we're not going to give oxy, you got to try these cheap medicines first. And so as you drive people away from the practice of good pain medicine, and you try to change the medicines and push people, they're going to go to the street because on the end result, heroin is cheaper, so is crack cocaine, So if you push somebody far enough, what are they going to do? Why would a patient, and the typical patient today that I have to see, they may not be highly educated, they may not be highly sophisticated, but they are sensitive that they're being scrutinized, they have to sign pain contracts, they have to go to pharmacies, and I have highly sophisticated, educated people that are made to feel terrible by these restrictions. Well, how does that help? That doesn't help where the drugs are coming in over the border, does not help the people who are highly addicted, who are getting their medicines off the streets. And frankly, if an addict really wants pain medicine, they're not going to come to me.
I don't know exactly what the long-term goal of this type of direction. What is the end goal? The end goal is to get everyone off pain medication? To go about treating people and medicine as a whole in that manner, I think it's ridiculous. It's who is the focus of that? It's not the patient.
The issues here, I believe, have to be addressed by our politicians, by our governors, and the Democratic Party, the Republican Party, the Independents, everybody, because as we sit here today, I will tell you, I see a collapse of a treatment for people in pain and people with addiction and suffering. That's going to become a major problem, and these statutes are not the answer. I propose that we bring information to the general public to demand that pain patients have a Bill of Rights, and that all people who have health problems should have access to insurance, to have access to treatment, and that we stop using statutes and using the law to manage people's problems. If that were the case, they should make a law that everybody should have a job and a high wage. Why don't we make that law? Why don't we make a law that says everybody should have a house, and that if the banks don't want to fulfill on the mortgage, that somebody will pick up that mortgage from the guy. Why don't we make those laws? I realize that's tongue-in-cheek, but if you want to attack a problem, I think the problem should be attacked with education, research, and applying rehabilitation and taking these funds to do that. It's been shown time and time again that the problem is within society. It's not the drug, it's not alcohol, it's not the gun. It's how they're being used and why and what's emanated.